I'm a internist. I'm a kidney doctor by trade. I've spent most of my life in science, first as a basic scientist studying literally how the kidney works. And then in the last, I thought, part of my career, I would try to get back into science and focus on something that was really what I thought was important. And what was really important to me was figuring out a way to measure how well do we practice medicine. One way to measure how well we do things is through electronic health record. Is it a measure of a doctor that they prescribe medicines that don't work? They don't work, but the doctor doesn't know it. Heavily advertised, there are all sorts of reasons. But the point here is, how would I ever study that? And I thought through the electronic record that I would see what the patients are on. My mother's 91. I was taking her to the doctor today, pulled out the Lipitor, which is a statin to lower the cholesterol. Why does a 90-year-old woman with no heart disease need a lipid-lowering drug where it has a huge risk side to it? Here's a simple decision tree. I have to treat someone without blood pressure medicine. Do I give them one drug 1 or drug 2, or whatever I say, drug A or drug B? She had to take all those medicines. She used to come to my apartment, this is my house, and she'd go, Herbie, why do I have to take all these medicines? And so I'd sit there and I'd be all angry at all the doctors. You don't need that. And then at the end of the day, I realized she needed every single medicine. So now, what does that tree look like with those co-pharmacies and comorbidities? It's not possible to factor all that in. Or the machine's going to have some simplifying algorithms. Like, all right, that doesn't happen that often, we'll eliminate that tree. Or that doesn't happen that often, we'll eliminate that tree. We'll really home in on like a couple of really key elements. So if we humans couldn't compute the tree before us, we certainly can't do it here. So decision analysis, nobody's working on that right now in artificial intelligence, in part because you need to populate, you need to find the probabilities, and basically at this point only Watson can go through the literature and plug in those probabilities. IBM's Watson, which can, at now, it's probably hard, can read 2 million pages of medical text per second and know what it says. And this means that we're in the next phase of medicine, sort of the computer phase, where we are going to be able to have smart machines interacting with data that's in electronic health record.